Zanusha.
Okay, thank you. Okay, welcome back, everyone. Today we are going to dive into the topic of Kampavata, or also can be correlated as Parkinson's, and we'll also be talking about Pada Daha and Pada Harsha, which basically Pada is feet, and Daha means burning in the feet, or Harsha is that pricking or tingling sensation in the feet. So even though it says it in the feet, but it's basically representing the same thing as all types of neuropathy, some of the major symptoms you get with neuropathy. So we're going to look at neuropathy, non-diabetic neuropathy, by the way, and also Parkinson's today from the Ayurvedic perspective. And a little bit of mention of some of the Western diagnostics that you're going to come across, and probably some of the treatment that you can typically see with patients who have these conditions. Okay? Okay, so before we get started with the topic, a little prayer. Yo Vishwam Vidadhati Pati Satatam Samharayatyanjasa Srishtva Devya Mahasjadischa Vividhan Duri Karotyamayan Vibhrano Jalana Chakasti Bhuvane Piyushapurnam Ghatam Tam Dhanvantari Rupamishamamalam Vandamahe Shreyase Vandamahe Shreyase Vandamahe Shreyase. Om Shanti Shanti Shanti. Okay, so today's topic. So let me just share the PowerPoint. I've sent this out to all of you, so hopefully you were able to get it on time. If not, it's going to be on the screen, so you can have a look now and you can refer back to it afterwards. Okay. Okay. There we go. So Kampavada. Kampa literally means when there is tremors or shivering or shaking, uncontrollable shaking. That's what Kampa means. So Kampavada is, of course, a disease or a condition that's due to Vata. Okay? And typically what we see is, what we see in this Kampavada situation, it's as described in the classical text. It's a condition where there is aggravated Vata that is circulating all over the body, and what that does is that tends to, again, as we've seen in some of the earlier conditions, it dries out the surrounding structures. So it starts to create a generalized condition of dryness in the body. And in the process of drying out, it's not just drying out particular tissues, but it's also in the sense of drying out nutrition. So because whenever you consume food or whenever we eat food, it is consistently rebuilding and forming new healthy tissue. And that is a form of a natural structure. So when they say drying doesn't mean only as the feeling of dryness, but it also means to slowly deplete the structures that it is coming in contact with. So since this is affecting Vata that's circulating throughout the body, that depletion can be a dispersed or generalized depletion. What we tend to usually find is that the depletion can manifest or can be localized depending on which areas are weaker or which area there is more of a void or a vacancy. So basically looking at different organs that are empty, or that have have sort of a space or vacuum in it, that's the place where Vata tends to naturally go and sit because it has more space for it to move around. So for instance, examples of organs like that is something like the bladder, where Vata, because it can expand, so it tends to have that place or space where Vata can accumulate there and circulate. Other places, other organs like that. So for instance, even the colon is actually sort of an empty space, and as things move throughout it, it becomes filled, but for the most part, it tends to stay empty. Only a certain part stays filled, but the rest of it is empty. So that's again another place where Vata can circulate and move very easily. So like that, there are organs wherever there is a space where Vata can sit there and accumulate, where there isn't enough nutrition, then obviously Vata is going to be more drawn to those areas, and it's going to circulate and start to dry out those areas. So that's why if we are looking at, again, the pathogenesis and the cause for these Vata-related conditions, you notice that it seems like I'm repeating myself. It seems like we're going over the same thing over and over again. But that is because that's exactly what happens. It's the causative factors for these Vata-related conditions is basically the same. The way that it represents or it manifests in different ways or in different areas is depending on these weaknesses or depending on where the depletion is occurring more. So for instance, remember when we were talking over the weekend, we talked about different situations, like for instance, where the person is stressing more on or where the person is more active. So for instance, if the person is a runner, they will naturally tend to they're using their feet more, they're using the muscles in their legs more. So that becomes more prone to having Vata being aggravated there. If the person tends to, if they're constantly sitting and if they are in a situation where they're bending their back a lot, then that's the area that is being moved or has the maximum amount of stress there. So that's why Vata can settle specifically in that area. Similarly for the neck, and so on and so forth. So that's why the causative factor is basically the same for aggravation of Vata, but it looks for a place to manifest. And in saying that, remember when we talked about the prerequisite for this class or this module, where we were looking at how this dosha aggravation tends to occur and it sort of stays latent. Remember, it stays latent and then it manifests or it becomes seen or it becomes rupa when it gets a chance to have the maximum amount of trigger factors that gives it strength. And so it manifests in that area. So now keeping that in mind, that's why typically Parkinson's disease or Kampavada tends to manifest in people who are in the later years of their life. So more in the elderly or in the vriddhavastha. Okay, and because the reason why that happens is because you have the maximum amount of Vata aggravating situations or Vata aggravating scenarios at that time. So it's not just the fact that they are in the Vata stage of their life, but typically what happens is you naturally tend to have more amount of depletion at that stage of life. You tend to naturally have already gone through the Pitta stage of your life where you have overworked yourself and sort of again depleted everything that you have and all the nutrition that you have. So as you stop that, your body gets a chance to catch up with all that you've been doing, and so therefore you start to see the depletion at that point. So in all aspects, also typically what you see is you get all of these other Vata aggravated symptoms. So as I see here, as we see here, depending on the Dushya, Desha, Bala, Kala, Anala, Prakriti, Vaya, Sattva, Satmya, Ahara. These should be very familiar to you because these are the 10 aspects that we look at in pariksha or in examination of the rogi, okay? And where we're looking at the factors of what's occurring in the actual person, right? And the reason why we look at that is because that is what determines how severe or how mild the disease will be. And that's also what helps us to determine how aggressive or how mild we need to be with our intervention, okay? So depending on these factors, that's why the presentation of this vata condition may vary. So for instance, as we'll go into the actual signs and symptoms in a minute. But in this condition, typically what happens is, again, due to these vata aggravating factors, there's a form of lack of nutrition that tends to cause, again, dryness, which results in rigidity or stiffness of the muscles and tendons, and that results in the body shaking uncontrollably. That's how it's manifesting. Okay? So what are some of the typical signs and symptoms of this condition? Of this specific presentation of a vata vyadhi or a vata disease, what you tend to have is kampa or tremors, this uncontrollable shaking. What you also tend to find is gurutva. The body tends to feel heavy, which can represent, what do we mean by the body feels heavy? It doesn't actually necessarily look heavy, but it feels heavy. It feels like dead weight. So this is what the person will be feeling, where they find it really difficult to move their limbs or move in that particular manner which they usually would, because for them it feels heavy. It feels like they can't actually lift or move that in that particular fashion or that particular manner. If you notice, this is also very similar to what we looked at in Pakshaghata, or in the symptoms of stroke and hemiplegia, because they're also, again, the same vata condition, but it was manifesting and it was occurring at a different part in the body or in a different part in the brain. This doesn't necessarily have to start in the brain, but it actually starts to affect directly the muscles and tendons on its own, okay? You also get depletion. The depletion is generalized. It's not localized. In the condition of Pakshaghata, or hemiplegia, there the situation of vata aggravation is localized to a specific part in the brain, and then it then starts to trickle down and starts to affect the actual motor function of half side of the body. Okay, so it is localized. But in this situation, you have an aggravated vata that is generalized. It's causing depletion throughout the whole body. And that's why the tremors or the shaking or the heaviness is not localized to any one side of the body or to any one particular limb, or either the upper limbs or the lower limbs or any one side. You can find the shaking and tremors in the head, you can find the shaking and tremors in the hands, and you can find it in the legs as well. And if not even in the extremities, you may even find that there are other parts of the body that shakes. So for instance, even their shoulders tend to move or shiver or shake uncontrollably. Sometimes you find that their lips or their jaw tends to shake uncontrollably, so you get the teeth clacking, that sort of symptom as well. All of these basically means that it is a motion or a movement that is uncontrollable. It is not something that the person is, they're commanding that part of their body to do that motion or action, but it is happening on its own. It is involuntary. Where it should be voluntary, it is an involuntary movement. So that's what typically happens in this situation of Kampavada. So Parkinson's disease is a very similar translation, but Kampavada is not just only Parkinson's disease. Kampavada can be any form of tremors or any signs or any issues where there is uncontrollable movement, okay? So as we saw with Pakshaghata as well, it is sort of very closely translated as hemiplegia, but it's not only hemiplegia. It can be any sort of situation where you find this presentation of lack of movement or lack of coordination of the limbs of half or one side of the body, okay? So you find also gurutva, that heaviness in the body, which means they are not able to control that particular limb or that particular area. So they find it very difficult to move in the manner that they wish to move. They also find stamba, which is stiffness or rigidity. As we see, there's rigidity in the muscles and tendons. And then some classical authors have actually even mentioned this as a condition where kapha is hindering or blocking the movement of specifically Vyana Vata, because we know that Vyana Vata is that which circulates and moves throughout the body. So this is a Avarna. Remember, we were talking about the different presentations of Vata conditions where it can be due to Dhatu Kshaya, where there is depletion of the tissues, and it can also occur because of Avarna, or something that is blocking the natural flow or movement of Vata. So some classical authors say that this is an example of that sort of presentation, or that sort of samprapti, where it is Kapha that is blocking or hindering the movement of specifically Vyana Vata. Okay? So just as a review to look at what the functions of Vyana Vata is, if we look at it again here, that makes sense. Vyana Vata is located in the heart and moves all over the body with great speed, and it attends to functions of movement, expansion, and contraction. And so what they mean by that is all forms of expansion and contraction. So whether it is the heart expanding and contracting, like a particular organ or muscles, so for instance, actual motor movements, so that is also an expansion and contraction. When your muscles move, when it expands and contracts, that's what helps us to actually create certain types of movements. Okay, if it expands, we are extending. If it is contracting, then we are bringing it in. Okay, so that again is a movement or a function of this Vyana Vata. So that control of that expansion and contraction. So upward movement, so that's also in the functions, as well as the upward movement, physical upward movement, as well as downward movement. The downward flow of Vata, the downward flow of specific fluids and in a specific manner, peristalsis, all of that is done actually through Vyana Vata. Okay, and all of these other functions, these are things that you know. But here you can see that clearly in this condition, it is an issue with motor function. And that motor function is nothing but, again, the functions of Vyana Vata. So when there is a block, or there's something that's hindering this normal flow or this normal function of Vyana Vata, and when this is how it presents, it can present in this particular manner. But again, the causative factors for why Vata will get aggravated in the first place is, again, it's the same issues, same sort of nidanas or causative factors that aggravate Vata. So those are, again, this is the same list that you have in your notes. And I put it in here just to, again, review, because in order to cover the causative factors for Parkinson's, there really isn't anything different. It's, again, the same causative factors that aggravate Vata is the same thing that can cause Parkinson's. So you may ask this, okay, well, if that's the case, okay, someone is intaking dry and cold foods or less quantity of food or light food, they have any number of these particular causative factors. So does that mean that everyone is going to get Parkinson's? No, not necessarily. You know why? Because remember in the first slide, I said these 10 factors here, is what determines the intensity or the lack thereof of the symptoms, okay? So depending on how much of these particular causative factors the person has in their daily lifestyle, in their regimen, in their charya, okay? In whatever they're following, and how long the chronicity of this exposure. That also gives us an idea as to how strong the imbalance is. So this again takes us back to looking at, so this basically looks at how much of Vata aggravation is actually occurring, okay? So these are all the typical causative factors that we've looked at earlier, you know, excessive sexual intercourse, frequent staying awake at night. We know that all of these things aggravate Vata. We know that they aggravate the qualities of Vata in the body. So therefore, it further, again, aggravates Vata. When we talk about Vata aggravation, earlier we had looked at Vata aggravation, but we didn't look at what happens when Vata gets aggravated. So we know the signs and symptoms, but we haven't ever previous to this looked at the actual diseases that it produced. So this is looking at all of the different diseases that when Vata gets aggravated, what it can produce, okay? So looking at these factors, this Vata fills up in the channels of circulation, and that which causes, due to weakness, it becomes weak, and there's lack of quality of unctuousness, so it creates more dryness in the body, which is basically the same subproperty that we mentioned before, and it tends to dry out the structures, and as well as causes depletion of the dhatus, okay? So in looking at that, again, if we looked at all of these factors here, they tend to really look at how they first manifest in the GIT. So here again a revision in how the doshas move, or from where they start to get aggravated and where they move, and how they become more and more chronic. So again, where the person has consumed or has n number of those causative factors in the previous slide. What that does is that slowly adds and adds and adds to Vata aggravation. Now this Vata aggravation typically starts in its own place, and what can happen is it starts to then spread, and it starts to affect other places as well. So it'll start moving to the extremities. The Vata will start causing dryness in the extremities. What it also does is it starts to affect the dryness, and it starts to affect the bones, which naturally will happen because that again is a stage or a place where Vata does its functions. Also, the reason why they have put this in a lower stage of how the doshas move is, if you look at the consecutive order of the dhatus, Asti is one of the lower dhatus. So in order for it to get to Asti, that means it would have already started to affect all of the other dhatus to then get to Asti. So even though Vata does carry out its functions through Asti dhatu, doesn't necessarily mean that every time Vata aggravates, it will directly cause an aggravation in Asti dhatu. It needs to be significantly strong or significantly aggravated in order for it to start showing the changes even in Asti dhatu. Because this is what this is basically describing is, again, levels of chronicity. Okay, so if the doshas are in the GIT, it's easier to treat. If the doshas start to aggravate or reach the extremities or the shakhas, then it's a little bit more difficult or a little bit more challenging to treat. If it has started to affect the bones and the bony structures, then it's a little bit more difficult to treat because it's more chronic. And if it has started to reach the marmas, not just the marmas as the vital points, but also the vital organs. If it has started to affect the vital organs, then it has become very deep-seated, and it requires a longer aspect of treatment and intervention. And it requires something to be a little bit more aggressive and for a longer period of time. And you have to consistently reassess where the dosha is at and how much you need to then help to pacify that. Okay, so thinking of all of that we just talked about, now look at this is basically the big picture right here. So what affects, how is this Vata aggravating? How is it manifesting? Again, the same old story. So we looked at the list of all the things that causes Vata aggravation. If we look at those, again, the question should come. Does that mean that everyone will develop Parkinson's in their older age? Not necessarily. The reason why is it depends on these factors. When we say it depends, there's something behind that it depends as well. And this is what is behind that. So in looking at the 10 factors or the Dashavida Pariksha, Dosha is basically the aggravated dosha. Desha is the place where the person is located, as well as Desha, the place where the dosha is located in the body. Okay, so Dusya, Desha, Bala, the strength of the person, the strength of the disease, as well as the strength of the patient. So now do you see why we talked about this before? and how it is now relevant in understanding who will end up getting Parkinson's and who will not, or who is more likely to have a more severe condition of this as opposed to who is not. Now it should start to tie in together, okay? So you have Dushya, Desha, Bala. That's the strength of either how strong is the disease and how strong is the patient. Kala, the time, so the seasonal factor. Is this adding to the strength of the disease, or is it taking away from the strength of the disease and adding to the strength of the patient? Kala, Anala, the Agni. If the person's Agni is also contributing to the disease, so for instance, if the person has Vishama Agni, of course, it is going to add to more of aggravation of Vata, and therefore also giving one more push to that Vata becoming more chronic and more strong to then develop this condition. So, Anala, Prakriti, the person's Prakriti, the person's innate constitution that either makes them susceptible to this condition or not susceptible to this condition, okay? So for instance, if this is occurring in a person who is more Kapha Prakriti, that Kapha Prakriti itself is going to give them more strength for the patient, and it will help to pacify some of the symptoms of the aggravated Vata, okay? So the Prakriti either works for them or works against them. When it is working for them, it is working for towards the person's innate strength or their immunity or their ability to fight off the condition. Okay, so Prakriti, Vaya, age. So here again, we see how important age plays a factor in this situation, because Parkinson's is a condition that tends to be more predominant in the later stages of life. Now, that's not necessarily the case, because there are certain conditions where you have early onset Parkinson's, so just like you have early onset Alzheimer's, it can happen. And that can happen when, despite the age, all of the other factors are feeding into the disease. All of the other factors are all Vata, very strong Vata related conditions. They're all feeding into Vata. So even though that the person is not in that age where Vata should be aggravated, all of the other factors are stronger. So the age is not something strong enough to help to prevent the production or the manifestation of this condition. Okay? So Vaya. Dusha, Desha, Bala, Kala, Anala, Prakriti, Vaya. Sattva. Sattva is the state of mind. That also is extremely important, because one of the typical signs and symptoms that you do find with this condition that tends to happen once it is already manifested is the person can develop depression, because of the fact that this has such a great impact on their ability to move, on their sustainability, on their independence, that they do end up falling into a depression because they feel that they can't do the things that they're used to doing. Okay, so that again indicates either their mind is going from Rajas to Tamas, or if it was Sattva, it was going from Sattva to Rajas. And we talked about this again. So here you can see how it's all tying in to either this manifesting or not manifesting in a person, how that equation is balancing off. Okay, Sattva, Satmya. Satmya is their habits. So habits looking at, for instance, does the person drink? Do they smoke? Do they take other drugs? Do they have these sort of habits? Because that, again, is a very strong influencing factor on whether this will cause manifestation of Parkinson's, or if it will hinder or block that manifestation of Parkinson's. Okay? Sattva, Satmya, Ahara. Of course, we know Ahara, their dietary factors and their dietary habits, and how that will then play a huge factor in looking at how it affects either the disease or the patient. So now you can see that when we use this Dashavida Pariksha, the reason why we're doing that Dashavida Pariksha, the reason why we're looking at these factors is we want to figure out how much of that, all of the layers or all of the perspective, all of the things that make up a person, make up a being, whether they are working in favor of the disease or working in favor of the patient, because that's really what's going to determine how strong this disease is. Okay, so that again basically is kind of like an equation. So we are looking at, in the Dashavida Pariksha, all those 10 factors, it kind of falls under these, and it kind of falls under what affects this. Okay, so it's basically looking at this whole factor right here. And then we can determine if the person does have Parkinson's. From looking at this, we're looking back, because by the time the person comes to us, they've already developed the disease. So by looking at this disease, we determine how many of these factors had a part to play in this being manifested, and how many factors were actually against this that worked in the favor of the patient. Okay, so in that aspect, that really gives us an idea as to how strong this condition is, how much we need to really make a change, or how much can we make a change, how aggressive we need to be in our intervention. Okay, I hope that is kind of clear and starting to now consolidate in your mind with all of these different things that we were looking at before. It's starting to now form a very clear idea as to why the person is having either Parkinson's or either Pakshaghata or hemiplegia, or it is manifesting as Katigraha or Gridrasi, where they're having sciatica, or if it's acting as Griva Graha, where they're having cervical spondylosis. So now you can see, if you're looking at the progression of disease, you can see these are all Vata-related conditions. And sometimes you can even start to then trace and create sort of a storyline, because most likely the person who ends up with Parkinson's would have surely had these Vata aggravating symptoms and these Vata aggravating conditions long before it came up over here. Okay, so what you're going to find is, if you find the person at this point in time, by the reason why we take the history, the reason why we look at all these factors is to figure out how the major causative factors are always going to still be there, how chronic this exposure is, how it would have developed. Did it keep developing in this positive direction? Did it regress and then come back again? Did it regress and come back again? And how many times that happened before it then manifested as Parkinson's? Because Parkinson's won't come up, or Kampavada won't come up on its own without having that progression. Okay, so typically you're going to find this progression, which is, again, if we want to look at it from the Ayurvedic perspective, Shaya, Prakopa, Prasara, Sthana, Samshraya. Okay, and then from there, looking at the 6 stages of Samprapti, what we're looking at here is Vyakti. But this Vyakti doesn't mean that it has to be only Vyakti of this one disease. It could have gotten up to these different stages of Samprapti, then gotten better, either due to seasonal factors or change in their diet or change in lifestyle that worked in the favor of the patient and worked against the disease, so it regressed. And then they again exposed themselves to these Vata aggravating factors, and again it manifested. It may have manifested as something else, as a different Vata Vyadi, but then again it may regress, and it may again progress. So now can you see the reason why we start to put all of this together is because it's giving us again that clear manifestation of if it is, how chronic it is, how strong is the Vata, how much we need to do. Okay, and what can we realistically expect to do. Okay, so looking at the functions or what happens when Vata gets aggravated, now it's pretty clear. in this particular situation, these are some of the symptoms that you find in the condition of Parkinson's. So dropping here means in the sense that, you remember we were talking about the foot dropping. So that tends to happen again in aggravated vata. So the person, even in Parkinson's, the person's leg tends to be, or their feet tend to be sort of pronated. It's not, again, they don't have the strength to move it. They don't have the strength to keep that particular particular rigidity of their muscles, or the natural stability that it should have in order to stay straight and not drop or not be extremely flexed. So that dropping tends to indicate, again, the weakness, that the muscles itself cannot remain in its integrity and in its stable position. Okay. Also, what you find, weakness of the body parts, you do find depletion, you do find some form of muscle wasting as well. You find, of course, rigidity, stiffness, and you can even feel it. Like if you palpate their muscles and palpate their tendons, you tend to feel how stiff it actually is. It's not soft, it's not movable, but it's very stiff and stagnant. Okay, and not stiff and stagnant in a strength in a healthy way, but rigid and hard and sort of uneven, that you find with this condition. Of course, tremors, which is, again, it's a natural aggravated function of vata. And notice here, these all seem to be sort of obscure or abstract. But if we look at these symptoms, the intensity of these symptoms is again determined on how chronic the vata aggravation is. So for instance, if somebody's really hungry and they haven't had something to eat and vata gets aggravated, and even in that condition, you can have tremors, right? Or if someone has, they've had a fever and that fever has caused severe depletion. They've had a very high fever for a couple of days. Even in that condition, you can find tremors. You see the difference between an immediate aggravation of vata causing mild tremors. You eat, it goes away. You get a little bit more chronic condition where vata is aggravated, you get the tremors. It takes a little bit longer, but it does subside. The more chronic or more stronger the vata aggravation, the more intense these exact same symptoms are. That's the reason why it seems, again, if you're talking to someone who's never heard about Ayurveda or they're learning it for the first time, you tell them all these symptoms, like, oh yeah, I get that, that's a vata symptom. But now you can see that these symptoms aren't just symptoms alone. These symptoms can also be assessed as actual disease conditions, depending on the intensity, depending on how strong or how chronic this vata has aggravated to produce the exact same symptom, but instead of it being a mild symptom, being an actual then disease. Okay, so if you look at all of these particular symptoms, all of these can be diseases too. They can be very intense or very mild, and if they're very intense, they can actually be a disease on its own. Okay, that's why, again, if we look at it in Ayurveda, you don't necessarily need to have names for all diseases, because we're looking back again at the same situation. This is how we determine. So we don't necessarily need a name. Kampavata itself is not considered as a separate disease. It isn't given Kampavata separately, and this is Parkinson's, but it is a symptom. It is a symptom of aggravated vata. And what determines if Kampavata is an actual disease is determined by the intensity of vata aggravation. Okay? So I know it seems like I'm repeating myself a lot, but it really is exactly that. Okay? So, clinical features. This is from a Western perspective. What do you typically see with a person who has Parkinson's? And again, same exact thing that we expect with a vata aggravation. The person's head bends forward, okay? So this, again, what typically happens is there's loss of integrity of the muscles, and there's loss of integrity of of the tissues that help to keep the body upright, the proper nourishment that helps to keep the body upright. The bones itself start to dry out, and what they do is they shrink or shrivel. So remember in the weekend, someone had mentioned that when they think about the aggravation, they think of shriveling. So this is exactly that. This is the body slowly starting to shrivel up, and it starts to bend forward. You have both presentations in Vata aggravation. It can either bend forward or it can even bend backward, okay? Both presentations are there. That is Antaryama and Bahiryama. Okay, Antaryama is this situation where the person bends forward. Bahiryama is when it is bending backwards. But both situations happen when there is aggravation of Vata. Tremors in the head, again, tremor itself. So you tend to find tremors in any one of the limbs in Parkinson's. A mask-like face expression, which is basically the stiffness. It is stiff, it is stagnant. There is no control, voluntary movement or control of the muscles in the face. That's why it tends to be in one position. It doesn't move. It's very hard for the person to control or to show emotions. Drooling. Drooling is, again, if there isn't proper muscle tensity and muscle tone, it won't be able to keep the oral cavity closed, so therefore it's very easy for the saliva to come out. We also saw this in Ardita or Bell's palsy. We also saw this in Pakshagada or hemiplegia. Okay, same symptom, same causative factor. Okay, just a slightly different presentation. Of course, rigidity, stiffness, stooped posture, which is again the Antaryama. Weight loss, the depletion of dhatus. Tremors, again, kampa, uncontrollable movement. Akinesia, which is absence or poverty of normal movement. Again, it is lack of the ability, strength, as well as the ability to move because of the heaviness that the person feels. You've ever seen someone who's very weak? It's almost, and try to lift them, it's like dead weight. So the person may be very weak or they may be very depleted, but when you lift them, their body feels heavy. So you think, how is this possible when this person has no nourishment at all? It's because the body itself does not have the ability to move. There is not a proper tensity, a tone, and elasticity of the muscles. They just tend to drop. So because of that, the body itself feels heavy, okay? So you find this, that there isn't proper normal movement because the person itself feels their body heavy. And if you try to lift them up, you will find that their body feels heavy, okay? Loss of postural reflexes, again, that movement, the contraction and expansion that we talked about, that's a function of Yanavata, that obviously gets obstructed. And so there isn't proper reflexes. Bone demineralization, again, that is aggravated Vata in the Asti. Shuffling and propulsive gait, that means, again, there isn't enough balance and the person doesn't have, again, the same muscle integrity and tone and elasticity to control these movements. So in order to look at it, sort of summary of that, Vata is responsible for all motor and sensory functions, okay? So when there's aggravation of Vata, there will be a deterioration of these motor functions and the sensory functions, okay? Other signs and symptoms that you typically find with Parkinson's is you tend to find that tremor, which is called like a pill rollover tremor. So if you look at their hands, they tend to have this sort of tremor where it looks like their index finger and their thumb is rolling a pill. So you tend to find this kind of tremor, very common with Parkinson's disease, okay? One of the very typical signs that you find. So what are some of the investigations that are typically done for this? So for instance, if your client's coming to you and they tell you I have Parkinson's, they would have probably gone through this particular process. So one of the obvious types of investigations that's done, they do a neurological exam, and that's again to test the agility of the legs and arms, of course the muscle tone, the gait and balance. Okay, other tests are done, so there aren't really any other laboratory tests to confirm that the person has Parkinson's. However, they do these particular laboratory tests to rule out that it's not another disease condition, but it is Parkinson's. So how they rule it out is by doing blood tests to check for abnormal thyroid levels or for any signs of liver damage. They may also do a CT scan or MRI to check for if there's a brain tumor or a stroke, which for us would, the only difference in Kampavada and Pakshagada is in Pakshagada there tends to be an issue where there is a block of Vata typically associated with some form of Rakta being involved in that. So we typically look at the Rakta aspect of that. But if there isn't that, which we again look for the pathogenesis of it, and you have more of a purely Kampavata situation where it's more of a purely Vata situation, then we look at just treating the Vata itself, okay? And they also have this other scan that they do, which is specific for Parkinson's, but it's not usually available everywhere because it is quite expensive. So you may find that you have, they can do this other test called a PET scan, and that is a positron emission tomography. And it basically, it checks for low levels of dopamine in the brain, because that's basically one of the aspects of how they look at the pathogenesis for Parkinson's. What I'll show you in one slide coming up, where there is a reduction of dopamine levels, and that's basically what is considered as the reason why there isn't proper transference of signals from the brain to these nerves, and therefore they are weakened, so they move uncontrollably. There isn't a voluntary movement, but it's an involuntary movement, even though it shouldn't be there, okay? So that PET scan is usually the ideal test that they can do to check the dopamine levels in the brain. But again, like I said, it's not necessarily available everywhere because it is quite expensive. But this is a scan that is there. So if you have really great insurance, or if your client has really great insurance, then they probably would have had this. Okay, or if they're in a area that doesn't necessarily have accessibility to this kind of instrumentation, then they won't necessarily come with that test for you. So from the Western aspect, again, the major symptoms of Parkinson's, of course, tremor and shaking, that's the cardinal sign. Bradykinesia, which is sort of slowness of movement. Rigidity or stiffness of the arms, legs, and also the trunk. And postural instability, where there may be issues with balance or even possible falls, okay? What is the typical conventional treatment? Again, what your clients may be coming to you with. What the typical conventional treatment for this condition is they try to first, of course, increase the dopamine levels. And so they can do that in any one of these ways, or sometimes they use multiple ways of increasing the dopamine levels. So like that, they may use levodopa, or they may use dupa, which is a levodopa infusion. They may use dopamine agonists, which is something that's not exactly increasing the dopamine level, but it sort of simulates a similar reaction to dopamine. It's sort of like a pseudo dopamine. MAOB inhibitors, and these are some of the examples of the medicines that they may be taking with that. They may use Congentin or amantadine. So these are just an example of some of the medications that they may be on. Other interventions that are also suggested for Parkinson's, they may also be suggested to go for surgery. And in that, basically, they're looking at, the surgical procedure is looking at introducing electrodes by doing deep brain stimulation. So these electrodes are implanted into either specific areas of the brain, and it's used to actually stimulate the nervous conduction, okay? So this is one method, a surgical method of intervention for Parkinson's disease, okay? And looking at that, so one of our, if we look at the conventional aspect of what's happening in this condition, typically, again, as described here, we looked at how they described that how the dopamine levels here is what helps to have strong interactions between the nerves and the nerve endings in transference of the nervous pathway and of signals from the brain to the ending muscles and the actual motor functions. So dopamine helps in that normal and healthy transference. So when there is a reduction in dopamine, that's what's considered as one of the causative factors. Not necessarily a causative factor, but the result. This is what's happening in a Parkinson's condition, and that's why the person tends to have this weak transference. Okay, so if we're looking at that, the Western perspective is to increase the dopamine. We have certain natural herbs that tend to have this, tend to naturally have phytochemicals that help to increase the dopamine levels. So one great example of that is kapikachu or mucuna pruriens, also known as some of the common English names for that is cowhedge or velvet bean. So this is a picture of kapikachu. It's very commonly used actually in Ayurveda, not only for vata conditions, but it's actually somewhat of a rasayana and a vajikarna. So the action of this is, looking at the Ayurvedic properties, its rasa is madhura and tikta, it's sweet and bitter. Its guna is snigdha and guru, it's unctuous and heavy. The vidya is ushna or hot. The vipaka is madhura or sweet. The prabhava is that it pacifies all three doshas. And also what they looked at is the phytochemical. It naturally has a very high percentage or occurrence of L-dopa, which is also the same thing as what you're looking in the levodopa. Okay, so what they're artificially creating with these medicines, you can also find the same phytochemical in this plant. So kapikachu, they've done quite a bit of studies on this, and they found that it is very effective, easily absorbed, and it does pass the blood-brain barrier, which is really important if you're looking at it from this perspective of how it's helping in increasing or repairing that normal transference, nervous conduction, and how this particular phytochemical can play a part in that. If we look at it from the Ayurvedic perspective, there also it makes sense why kapikachu can be used in a vata condition because of the actual properties of it. All of these properties help in pacifying vata. So you may ask this question, hopefully this question came to some of you. If you saw tikta rasa, you'd think, well, tikta rasa isn't something that helps to pacify vata. Then why would we want to use something that has tikta rasa in it or is bitter? Because one of the reasons, tikta rasa is one of the only factors in this herb that does aggravate vata. But if you look at it, sometimes when we make these combinations, they are very strategically done because we use the thing that actually aggravates the dosha, because what it does is it has a targeted site for that dosha. And in the process of it targeting the dosha, it also helps to bring along everything else that we've added to it. So tikta rasa will target vata, but also it's not just tikta rasa alone. It is tikta rasa with all of the other properties that actually help to pacify vata. So in this process, that's why this one herb has a targeted site of action to help to pacify vata all throughout the body. Okay? This is also the reason why this particular herb is considered, it helps in shukrajanya. It helps to actually increase the shukra dhatu. It's a natural aphrodisiac. It's a natural herb that's used for infertility, specifically male infertility. Okay, so this is a really great example, and studies have been done to show that kapikachu is quite effective in Parkinson's. So this is just one example of what we can do to help in this condition. This is available by Himalaya. They tend to come in capsules, and one of the ideal ways to take that is to give it along with milk, which again has a targeted site of action on the brain and the nervous system, or it can be taken with ghee. But usually when it comes with capsules, you probably want to use milk. Okay? Let me look at some of the questions here. Okay. Can you all hear me? The blood-brain barrier. The blood-brain barrier is it's sort of a lining, you can say. There's a lining in the brain, okay, that basically covers, it sort of protects the fluids in the brain from exiting out of the brain. So for instance, you have all of these blood vessels that do penetrate through and that supply blood to the brain, right? And you also have, apart from that, that these vessels or these particular capillaries or arteries that are going into the brain and supplying blood to the brain. You have a layer that goes over, sort of like a protective sheet or layer over all. You see all these little nuances and these little curvatures. It's basically a coating or a covering over this. And what that does is that protects the fluid, sort of like the cerebrospinal fluid, or the fluid that is produced within the brain. It protects it and doesn't allow it to come out. So that fluid is produced in the brain and it circulates throughout the spinal cord, and it's continuously being circulated throughout. That helps in nourishment of the brain and the central nervous system, as well as it helps to transfer a certain amount of oxygen and nutrients, okay? So this blood-brain barrier helps to, it prevents other things, it prevents that fluid from excreting or coming out of that sac, basically. But what it also does is there are certain things that aren't able to penetrate through that. So for instance, in certain medicines, when we look at the action of medicines, they have to be able to penetrate that blood-brain barrier in order to have a specific activity on the brain, okay? So typically what they've looked at is certain types of proteins can pass that blood-brain barrier and can actually enter into the actual matter or the actual tissues of the brain. And when it does that, then it can have an effect directly on the brain. But there are only specific things that will pass that blood-brain barrier. Typical other, these synthetic drugs, some of them, if the particle size itself isn't small enough, or if the molecule size isn't small enough, it will not pass that barrier. So therefore, even though it has a really great action, or ideally it would be great to be used for neurological disorders or to be used for issues with the brain or issues with nervous function, if it doesn't have that specific size or molecule or structure, it can't pass the barrier, and therefore it can't have that specific action on the brain. However, in Ayurveda, the reason why we use specific anupanas is because we use anupanas for the nervous system, because we know those anupanas do pass the blood-brain barrier, and they do act as vehicles. They do help to take these particular compounds directly to the site of action on the brain and on the nervous system. So examples of that is ghee, because it is a protein-based, exactly, ghee and milk, they're protein-based and they can pass the blood-brain barrier. So that's why we typically, even if we're using something like kapikachu, we either medicate it with milk or ghee, or we give it along with milk or ghee, because it can help to be absorbed in that manner, okay? So that's why we look at it in that perspective. So this is one thing that can pass the blood-brain barrier. So that's why it has a little bit of a better activity than some of the synthetic drugs. Do you need to increase the person's Agni to absorb the herbs? Yes, for the most part. I mean, whenever we do any treatment, ideally what we want to do is we always want to make sure that the person's Agni is increased, because that's sort of a basic thing. If we're giving anything internally, because our mode of administration is actually orally. That's how we introduce it into the body. There have been a few instances where people have actually produced Ayurvedic injections. And basically what they are extractions or distillation of certain compounds or certain phytochemicals from herbs. And they've tried to introduce that intravenously. However, for the most part, traditionally, almost all of our interventions are always given orally. So if it's going through the oral route, we do need to have the Agni strong enough that it can digest that, so that it can be absorbed and assimilated as quickly as possible. And that's what determines the different types of formulas that we use, according to how we can work with the Agni. Okay, and that kind of comes into the module where we'll get into different types of medication, because that's a big, long topic. A very interesting one, but a very big one. Okay, so this is an example of one of the particular herbs that we use that has been proven and has had quite a bit of studies done on looking at how this acts on Parkinson's. Okay, so you can advise Kapikachu, which actually is available in capsules for a person with Parkinson's. And if you can't do any of the other treatments that we're going to talk about, this in itself will really help to improve their condition. Okay. The next ideal treatment, which is basically the line of treatment that we do in Ayurveda, is looking at the Chikitsa for this. So typically what we want to do here is the similar concept of what we do for Vata Vyadhi treatment, where we want to do Sneha and Sweda. We want to oleate the body, as well as do fomentation that will help to replace some of the depletion, as well as to reduce the dryness that has occurred in the pathogenesis of this condition. So typically here, we tend to use oils that are even more nourishing than some of the other oils that we talked about. So remember, in the long list of oils that we looked at earlier during the weekend, as well as in the last the last webinar, remember I was telling you Kshira Bala is one that is more Brahmana or more nourishing in nature. So this is a condition where we actually would prefer to use that type of oil. We can use Kshira Bala for external application. We can use Mahanarayana oil, because that, again, is a very nourishing type of Vata pacifying oil. We can look at methods to pacify Vata in different aspects, either to get Vata moving, either to induce more heat to pacify Vata, or either to induce more amount of Snigdha to reduce the dryness of Vata, and also to do Brahmana, where we are actually trying to replace nourishment or replace the Dhatu Kshaya that has already occurred, to help to give that nourishment and stability to the structures, to those particular structures. So by using these oils, it does all of that. The action is for increasing nourishment, for reducing the dryness, as well as for getting Vata moving. Okay, getting Vata moving and flowing in the appropriate direction. So Mahamasha oil. Masha is black gram. So this is an oil. The main ingredient is black gram. It's not the only one, but it's a pretty big combination where they use, one of the main ingredients is black gram. Okay. Next one is Kshira Bala, which we had talked about. Mahanarayan oil. You can use all these externally. Internally, also, this needs also internal oleation or internal sneha. Okay, so for that we can use Dhanvantra Ghrita, or instead of using Dhanvantra as an oil, here we want more nourishment. We want it to pass the blood-brain barrier, so therefore we use it in the form of a ghee, a medicated ghee. So the same combination of how they would make Dhanvantra Taila, instead of using oil as the base, they use ghee as the base. So it is the Dhanvantra medicated ghee. Okay. Another option is, if you can't get that, you can get Kshira Bala 101, which means it has been processed 101 times. That oil is usually added. You add around 8 to 10 drops of that oil in a cup of milk, and that is given at bedtime. Okay, so this is how you can do an external sneha and internal sneha. We're doing oleation from all perspective and all sides, because we want to put back as much nourishment as possible. Okay, then we also can do swedana. Swedana here, you can do kaya seka, which is basically heating up the whole body by pouring warm oil. So you can use these same oils for the Kaya Seka, or if you don't have that much of oil to pour on somebody's body, then you can do the regular Swedana of a steam tent or a steam room or something like that. But ideally, typically we do Kaya Seka in this condition because we're doing both Sneha and Sweda at the same time. We're doing oleation and fomentation at the same time, okay? By using the same oils, but heating it up and having it poured over the body, okay? That is typically followed by a Mridu Virechana, or a mild Virechana. Mridu means mild. Here, in this context, it means mild. So we need to do a mild Virechana because we don't want to, already the person is going to be quite weak and they already have dhatu depletion. So we can't do too much of excessive aggressive panchakarma or aggressive shodhana. But what this does is this kind of helps to push or to provoke vata to move downwards, because virechana or purgation is basically inducing a downward movement. So by doing a mild version of this, what it's doing is it's kind of coaxing vata to start moving downwards. Okay, so you can do a mild virechana with either castor oil or with avipati karachurna, around 20 grams or so. Okay, so once we have done this very mild virechana or mild cleanse, getting vata to move downwards, then the main action here then is rasayana, where we need to start rebuilding and start rebuilding as much as we possibly can. So here also we can start rebuilding or nourishing or brahmana externally and internally. So externally, here is the application of where we would use the Shashtika Shali Pinda Sweda, or also known as the poultice with the cooked rice. This is the instance where we would use that, because again, it is due to complete dhatu depletion. So here we want to give back as much nourishment as possible. So we need to be instilling nourishment from all aspects. So external nourishment through this Shashtika Shali Pinda Sweda, and also internal nourishment or internal rasayana, either through Aja Mamsa rasayana. So that Aja Mamsa is, they're using goat meat to make a rasayana, okay? So Aja is goat, Mamsa is meat, and rasayana is the preparation. So there is, we do have a non-vegetarian rasayana as well. Of course, if your client is a vegetarian and they don't want to take that, that's fine. There are other rasayanas as well. Narsimha rasayana is another good option, where it's supposed to give you the strength of Narsimha, which is basically a person who is, it's an incarnation of Vishnu, where he's a man, half lion. So this rasayana is supposed to give you the strength of a lion. Okay, but it's not made of a lion, it's made of herbs, but they're all basically to increase bala or strength of the body. Okay, similarly, you can also use bala rasayana, or if you don't have any of these, you can use all of these brahmana and rasayana type of herbs, such as brahmi, ashwagandha, mandukaparni, or even shatavari, okay, or shankapushpi, okay. These are all some very commonly used brahmana and medhya. Brahmana means, of course, nourishing. Medhya means that which is good for the brain and good for nervous function. Okay, these also help to pacify vata, but their main action is really for nourishment and for rejuvenation. Okay, so this is kind of the aspect of how we look at the treatment for Parkinson's. Now, this is looking at just the herbal aspect. There are, of course, metals and minerals that we do use for this. I haven't mentioned it here because it's not necessarily relevant here, but doesn't mean that it doesn't exist. It is there. If you do require, or if you are interested and you want to know, send me a message and I will share that information with you. Okay? Okay, let me see the question here before we move on. How many days virechana? Typically, for this instant, you actually need to do only 1 day virechana. So because it's a mild virechana, we need to do it only 1 day. That's why we're using somewhere like 20 grams or around 2 tablespoons of castor oil. That will induce a purgation, but not a very strong or very, very aggressive purgation, okay? If the person has a lot of vata, which in most cases, even 2 tablespoons may not induce too much of a purgation. They may need more than that. But again, we don't want to over push it. You know, we don't want to create so much of a virechana that they end up losing even more of the nutrition. Because in a virechana or in any one of these purification processes, it is going to flush out the body, but in the process of flushing, it tends to also flush out a little bit of the necessary. That's why the person feels weak afterwards. So in this condition where the person is already weak, we can't necessarily cleanse too much, because that will also tend to take out the very necessary nourishment that they are holding on to, okay? So we need a very mild version of it. So I would say around 2 tablespoons of castor oil or 20 grams of Avipatikara Churna, and it's only 1 day, okay? Okay, so the next aspect, and I will hold some questions. I try to get through this. These are 2 smaller topics. The next aspect is neuropathy, and here again, same causative factor, very similar pathogenesis. In this pathogenesis, we're looking more of something that is avarna of vata, or that which is blocking or hindering the flow or movement of vata, which is very much understood with neuropathy, where there typically is an issue with the blood vessels, and there's a block in the blood vessels that is not flowing and not giving proper nourishment to the extremities. That's why there's an issue with the nerves and not being nourished. So therefore they're hyperactive or they're hypersensitive. Very similar concept of how we're understanding these conditions as well in neuropathy is the fact that we're not looking necessarily only at the aspect of the blood flow and that nourishment, but we're also looking at from the fact of vata being blocked and vata being aggravated and drying out the nourishment, okay? So in Ashtanga Hridaya, they state that when aggravated vata is associated with pitta and rakta, it gets localized in the legs and feet, and it produces burning sensation in a person who tends to walk a lot. Not only in a person who just naturally has an aggravated vata, but it tends to happen more typically in a person who walks a lot. Now remember, what I'm describing here is regular neuropathy. I'm not specifically describing that of diabetic neuropathy, because in diabetic neuropathy does have a very similar pathogenesis, but instead of it being just vata and pitta and rakta alone, it also has an issue with kapha and kleda, okay? So there's a little bit of an added factor in that. And so therefore, because of that added factor, the treatment will be slightly different than what we're going to look at for the treatment of this particular condition. So that it gets localized in the legs and feet, and it produces burning sensation in the person who walks a lot. This condition is known as pada daha. Pada is feet and daha is burning. Now, even though the condition is termed as pada daha, doesn't mean that it's any different for the hands. The same concept, if you want to look at it for hands, it is known as kara daha, okay? Kara daha is burning sensation in the hands. Pada daha is burning sensation in the feet, okay? So depending on where it is localizing, the manifestation is the same. It produces the burning sensation in that particular area, okay? So that's basically what we understand as pada daha. If there's association of aggravated kapha and vata, and it's localized in the feet, it produces symptoms such as pins and needles, sort of a pricking sensation. Also numbness, loss of sensation, and feeling as if the feet are asleep. So you ever notice, like for instance, if you sit on your legs for a very long time, you tend to feel like it's asleep, you can't move it. And when you do finally move it, you start to feel those, like that very severe pins and needles in your feet. That's actually a sensation of this pada harsha, okay? Where it's the pricking sensation in your feet. That's actually due to kapha and vata. because the kapha tends to accumulate and sit in one place, and it blocks again the movement of vata. So in the situation where you're sitting in your feet for a very long time, it's again the fat part of the leg or the kapha in that area tends to block again the natural movement of vata. Obviously, the pressure is also moving blocking the movement of vata. So when you get up and the vata starts to move again, that's when it starts to produce that extreme pricking sensation. Okay, so that is known as vata harsha. Here again, in both of these situations, the primary dosha is vata. However, it is blocked by the involvement of a secondary dosha or another dosha. And that's why we find that you find the symptoms of vata, but also you find a variation of vata symptoms along with whatever the secondary dosha is. So here again, you find pain in padadaha, but the reason why you get more of a pitta type symptom is because it is associated with pitta and rakta. Similarly, in the pada harsha, you get again the pain, pins and needles sensation, which is a vata condition, but you also get the numbness and feeling of the foot being asleep, which is again associated with kapha. That is the secondary dosha. The reason why this is important for us to know, because if we look at just the symptoms of burning and think it's only pitta, if you throw cold at it, what will happen? It won't go away. It'll feel better for a little bit, but remember, vata is still there. Vata plays an important part in the manifestation of this. So that's why throwing cold things at neuropathy where your foot is burning is not going to help. Similarly, in the condition where you have pins and needles, in this situation, putting something hot will help because it pacifies both kapha and vata. But putting something cold in that situation also will not help. Okay, so in situations like this, if you have pins and needles and you put an ice pack, not going to help because it will aggravate both kapha and vata. Similarly, in the padadaha, putting cold water on your feet will not help. Temporary relief, but afterwards it comes back with a vengeance. So if any of you have ever experienced this, you'll definitely see that it does happen. And I've experienced this temporarily for a while when I was in India in the summertime, and I had severe burning sensation in my feet, and it was unbearable. I couldn't sleep at all because it was so bad. But what I realized was that in that situation, pouring the water really didn't help. Even wrapping my feet in a wet towel also didn't really help. But when I finally started applying oil on my feet, that was the only thing that actually did help. Okay? So you see, you have to look at the actual manifestation happening, why this is happening, and not just look at the symptom and associate it with, oh, well, this must be pitta or this must be kapha. Let's look at it more deep as to how it happened. Even if it is pitta or even if it is kapha, how did it manifest right there? Why did it localize there? And that's going to give us an idea as to which is the primary dosha and which is the secondary dosha. So what we really need to be careful of. Okay? So in looking at that, this is pada. So if you're looking at this, so I put in this picture of diabetic peripheral neuropathy just to give you an example of a picture of how this is happening. It's a very similar concept of how it's described in Ayurveda. So just don't look at the diabetic peripheral neuropathy part, but look at here and see the nuances of the tiny little vessels that supply nourishment to that area and that also supply nourishment to the nerves. What's happening in this padadaha situation is that typically what we see is the arteries themselves, they tend to get convoluted and they tend to get sort of intertwined with each other, which is very much similar to Shroto Granthi. Remember when we talked about different types of aggravation of Shrotases? One is Granthi, where it tends to become like a knot. So in this situation here, the smaller, tiny little blood vessels tend to become knotted. And how to become knotted is actually because of vata. They get knotted because of vata when vata is moving too quickly. You've ever seen, like, if you try to pass water through a capillary tube, and the more water you put in it, or the faster the water is going, it tends to stretch out the capillary tube, and it starts to become, instead of being a nice thick structure or a firm structure straight down, it starts to go a little bit wavy and a little bit here and there because it gets stretched out, and that it becomes convoluted. Convoluted means it's not straight, it's sort of wavy, and then it becomes intertwined. And that's how it forms a knot or forms a granthi. So in that process, what happens is, because of the aggravated vata, it becomes weaker, it knots up, and then the blood gets stuck there. So the pitta and rakta starts to accumulate there. So you get not only that accumulation, but you also get the block of vata not being able to flow, because vata flows through all channels, all the channels. Okay, the flowing itself is done by vata. So you get the block of pitta and rakta as well as the block of flow of vata. That's how you end up with the pain as well as the heat and burning factor. Okay, so that's why it represents in both conditions of being a pitta issue and a vata issue. Now, looking at this particular pathogenesis or presentation is the exact same thing of how we look at in the inflammatory types of rheumatoid arthritis. Exact same presentation. And we're going to talk about this in the next module, but it's the exact same thing. So the same concept of what we do to treat that situation is the same concept of what we do to treat this situation too, because the pathogenesis is exactly the same. The only difference is here it's happening in the feet or in the palms of the person's hand, as opposed to in that situation, it's happening in their joints. Okay, that's the only difference. The localization is in a different place, but the pathogenesis and what's occurring is exactly the same. Okay, so here you can see what happens is that it gets convoluted. Then what happens, the more chronic it becomes, there isn't then proper nourishment. There isn't proper flow. Vata is aggravating there, so it's getting localized. It's sitting and moving about in that little place, so it starts to dry out that area. It starts to become malnourished, and it can even lead, depending on how chronic it is, it can even lead to necrosis of the tissues, which means it can cause death of the surrounding tissues. And so that's death of the muscular layer, death of the nerves and the nervous tissue, and also death of the arteries and veins in that area, and also the other surrounding tissues. So depending on how chronic it is and how much death of structure occurs, that can eventually end up into loss of complete sensation. Okay? So that's typically what's happening in the neuropathy or padadaha. Okay? In Padaharsha, what we find is, because of the association of kapha and vata, you end up with this issue of the kapha blocking the shrotas, and that creates this pins and needles sensation. So you notice in people who have neuropathy, they can have either both or even one type. And in any one type also, it's still considered neuropathy. That's why I included both of these here. So the more chronic the condition becomes, the more worse the symptoms are, okay? So like I said, in both Padadaha and in Padaharsha, because there's a block of flow of vata, there's a block of flow of proper nutrition and normal function and movement of that area, both can lead to necrosis or death of the surrounding tissues, okay? So typically what tests that are done for diagnostics for neuropathy, of course, a full medical history, neurological examination to test the different conduction and the health of the nerves, blood tests, of course, to rule out any other conditions, image testing such as CT scan or MRI, nerve function tests like electromyography or nerve conduction velocity. They may even do a nerve biopsy to see if there's any other structures or abnormal growths there, or they can also do a skin biopsy to check the concentration and the health of the nerves in that particular area, okay? The treatment for Padadaha as per Ayurveda, and this is again the non-diabetic neuropathy, here what we need to do, because again, it's a vata, it's a situation with vata and rakta and pitta. It's the same treatment what we typically follow for the inflamed rheumatoid arthritis, which is a condition known as vata rakta. Okay, so what we would use is internally we need to give medicines that pacify rakta and pitta, that also help to cleanse the channels and also enhance circulation. Okay, so things like that, examples of medicines like that is Gugulu Tikta Kashaya, because Gugulu itself, Commiphora mukul, is it's on its own, it's a herb, it's a substance that helps to cleanse or sort of remove any plaque. It tends to scrape out the plaque from channels. Also, Tiktaka Kashaya actually enhances circulation. Tiktaka is a herb that obviously is predominant of Tikta Rasa, which it aggravates vata, but by aggravating vata, it's enhancing circulation. Similarly, Guruchiadi Kwata, Guruchi is also another really good herb in pacifying vata, as well as pacifying rakta and pitta. Okay, so typically you can actually find this. They use the word kwata here. Kwata and kashaya are both the exact same thing. It's just they're synonyms for decoction in Sanskrit. So here, usually if you look it up, you will find it under Guruchiadi Kwata. And they come actually in kashaya tablets in concentrated form. Other things that work is Keshora Gugulu, that's also a tablet. Very similar action, or even Abhaya Rishta, that also works. External application that really helps for this particular condition is Pindatela, which is another really good oil for pacifying vata, but also it has a slightly cooling factor because of manjishta, and also because of the inclusion of beeswax in this preparation. Okay, so it really helps to give pacification of vata with a slightly cooling factor, not extremely cool, just slightly cool. Okay, Bala Guruchiadi Tela is another external oil that you can apply, has again the same action. Varuni Tela, same action. Or you can, if you don't get any of these, you can get a paste, get Guruchi and Neem, mix them together with some yogurt and apply that paste to the feet and let it dry. Okay, so that's another way to help to treat Padadaha. And this is looking at, again, Padadaha that's non-diabetic. If it is diabetic, that has a little bit of an added factor because we have to manage kapha and Kleda at the same time. Okay. The treatment for Padahasha, or for the pricking pins and needle sensation, here, because of the kapha accumulation that's blocking vata, whenever there's that situation, it's similar again. We need to first do drying, because whenever there's a avarna, we have to get rid of the thing that's blocking the vata. So first you need to dry out the kapha by drying and heating therapies such as the sand poultice, which we did, or the udvartana, the dry powder massage. You would do it localized, or you could do the rasnadi lepa, which we did again over the weekend, or you can even advise the internal intake of rasna saptaka kashaya. Now in all these kashayas that I've mentioned, I haven't given you a dose because the dose is kind of standard for kashayas. It's usually 15 ml, and these are prepared kashayas, the ones you buy from a particular pharmacy. You get 15 ml of the kashaya that is diluted or mixed with 45 ml of warm water, and that is usually taken around 30 minutes before a meal. It can be taken either once a day, twice a day, or 3 times a day. And the reason why we would choose either once, twice, or 3 times depends on the severity of the condition. Okay? Okay. So once we do that and we dry out kapha, the next part of it is we got rid of the block, so then we can pacify vata. So how do we pacify vata? We can use Bala Ashwagandha Kashaya, which again, Bala and Ashwagandha both are really great in pacifying vata. Or we can use Dashamula Kwata or Dashamula Kashaya. Dashamula are the 10 roots that are, again, extremely good at pacifying vata. They work in not just in vata in localized in any specific area, but it works in generalized vata, vata all over the body. So So actually it works really great for Vyana Vata issues, like for instance, even in Kampavada or even in this situation, okay? Or you can also do external application of Rasnadi Tela, or even in this situation, Shalaki, the Shalaki liniment works really well, even as a temporary fix. Continuous application of Shalaki can really help to reduce the condition significantly, okay? Because it really helps to pacify Vata. So these are some of the aspects of how we look at at Parkinson's and neuropathy from the Ayurvedic perspective. Of course, I've given you somewhat of a encapsulated short form of what we do for the Chikitsa. There are many, many options for Chikitsa. This is not the only option that I've described. It's not the only way. There are many, many options, but depending on the availability of drugs, depending on the severity of the condition, depending on how many factors, confounding factors, are contributing to this disease and really exhibiting the severity of the condition, that's what's going to determine either we use one of these, or we use two in combination with each other, or we use both the external and the internal, or we need to go at a longer route for that, okay? So when we say it depends, even in that it depends, there is a very structured way to determine how we want to choose, okay? And how you choose that really depends on what you're experiencing or understanding from the person who's sitting in front of you. Now remember, you consistently have to reassess. Well, how it is today may not necessarily be how it is in 2 weeks. A great example is right now. Seasons are changing. Even in the change of seasons, it may affect the severity or the intensity or the lack thereof of the symptoms. Okay, so we need to consistently reassess, and we need to also make sure that whatever we're doing is either aggressive or appropriate for that particular point in time. Okay? Okay. Someone has cold hands and feet, any relation, or is that a circulation issue? Yes, the cold hands and feet is a very similar situation where, again, here it's excessive vata moving about, but it also is associated with kapha as well. So you have to look for which situations of how much of kapha and vata you're finding in that person. And typically, again, it may be localized in one area, but doesn't mean that the kapha aggravation or the vata aggravation will be only in that area. You will find other signs and symptoms of aggravated kapha or vata somewhere else in the body. And in the other parts of the body, it may be mild, but it is much stronger in that particular area. So those are the certain things you want to look for. So even though somebody comes and tells you their diagnosis, I have this condition, you don't just stop at that. The reason why you still go through the whole intake form is because you're trying to figure out how it got to that, and if there aren't other underlying changes or pathologies that are waiting for their trigger factors to come up, or if they're the ones who are pushing and basically instigating this particular condition to manifest here. But if you just treat that symptomatically, doesn't mean that it'll go away. That's why even if somebody comes to you with their diagnosis, still go through the intake. Still try to get the bigger picture, okay? Or try to create a little storyboard in your mind, okay? Okay, so does anyone have any other questions? I know this was quite a bit too. It was a bit of repetition, but in one sense, it was good because hopefully that is, again, creating a little bit more and more clarity about the information that we've been talking about, or the topic that we've been talking about. Okay, well, if there's no other questions, then I will leave you guys to it. So I hope you have a very good night. And as usual, please do send me information about signing up for your mentor hours. And if you have any other questions, please send me the questions and I will try to get back to you. Could Ama with Vata or not just Kapha? It could be obviously Ama with Vata as well. And we're going to be talking about that in detail in in the next module, because that's when we're going to look at specific musculoskeletal presentation. Same again, Vata issues, but how it tends to locate in these particular areas and then create a pathology. So we're going to again be repeating ourselves, but we're going to repeat it and look at how it's localizing somewhere else, and then how it's creating that disease. But yes, absolutely, it can be ama with vata and not just kapha. Okay, good night.
Thank
Good
you.
night,
Good night.
Anissa. Thanks.
You're
Good
welcome.
night, Hillary.
Good night.